Hello everyone, I'm Dr. Francisco, a specialist nephrologist and transplant immunologist working at Francisco Kidney Medical Center in Singapore. Welcome to the Diabetes Health and Prevention video series. Today is time for part 12, which is the last one, which is on diabetes prevention, so I hope you enjoy it. All these talks were part of our efforts on health promotion, focusing on diabetes prevention and early detection. We mentioned that we have two health enhancement and weight management programs, Eris and Janus. Eris for the Greek god of war, so you can start your battle against sugar and start losing weight. Destined to younger individuals who are overweight and actively want to lose weight with diet and exercise. But we have also a more structured, complete program called Janus for the Greek god of new beginnings, new choices, destined to people who are overweight but also have already risk factors for metabolic syndrome of diabetes, or they already have metabolic syndrome of diabetes, and who probably are older as well, who wants to improve their health to prevent the development of these diseases or its complications. This program has health screening. There is personalized tailored diet and either fitness or physiotherapeutic advice. At the end of the program, we empower patients to take better lifestyle and diet choices after they leave the program so they can receive the benefit for the rest of their life. If you have tried and have failed or have left it for later, but you don't know when are you going to start, you can consult us. If you're interested, please call this number or send me an email, visit my website, my Facebook page. I trust with these programs and many other programs that are around, we can prevent diabetes and many metabolic chronic disorders. As a disclaimer, I need to say that this video is produced in good faith. They are just tips, general recommendations on how to prevent diabetes or its complications, but you need to check with your doctor to see if they apply to you. Let's talk about the prevention of diabetes or its complications. Lose weight is very important. Diet is crucial, but exercise helps. If you lose around 5% of your weight, you receive a lot of metabolic benefits. If you lose 10% of your weight, you can even revert fatty liver or a pre-diabetic state. I can tell you, obviously because I'm a doctor, but also I put myself into my weight loss management programs. I have lost already above 5% of my weight. I measured recently my glucose profile and my lipid profile. I could not believe it. It was so good. And indeed, I have lost weight. I feel much better now. That's the reason I am promoting my weight loss program, because I trust it's effective, because it's a very well structured program, and some friends, relatives, some patients are already benefiting from this program, so you can consider. You need to take better choices when you choose your sugar. Obviously, you know that this one contains a lot of sugar, but fruits also contain a lot of sugar. They are healthy because they have vitamins and fiber, so it's better an apple than a donut. But still, you need to moderate because they can spike also the sugar. Drinks also contain sugar, and this one is not the only culprit, as you can see in the picture. At the end of the day, water is the healthiest option. You also need to reduce your fat in the diet, fatty, oily, fried food, especially if you want to lose weight and improve your lipid profile. Visiting a dietitian is very important. Its role is undermined, underrated, underutilized. But if you want to be more effectively, you want to effectively lose weight, dietitian is crucial. It's the specialist at the end of the day, and more scientifically can tell you about your food choices, what you eat, what to change, what to moderate, what to avoid if you really want to improve your health. So please consider visiting a dietitian. However, the dietitian might impose some moderation or restriction in some components, especially on sugar, fat, and sodium. If you have kidney problems, there will be other restrictions. But what I can tell you, probably might not be easy in the beginning, but in my program I put myself, and I was surprised that it was easier than I expected. But I can tell you also that in my experience, most of my patients who follow a frugal diet, who have more moderation in their diet, they tend to do better than patients that encounter difficulties. But I trust with proper coaching and advice and some self-commitment and conviction that you believe this is the best for you for the rest of your life, you can do it. You just need to put your mindset into it, then put your actions, but obviously with proper encouragement and coaching, I trust you can do it. Doing exercise is very beneficial. It can help you maintain the weight, putting you in better shape, strengthen your heart, your lungs, your muscles, your joints, improve your mood, but also can reduce insulin resistance and favors glucose utilization and improve your lipid profile. Controlling the blood pressure is very important because high blood pressure damages the blood vessels. Diabetes is a disease of the blood vessels for the glycemic injury. If you add them together, this potentiates. So controlling blood pressure is very important. I advise all my patients to buy a blood pressure machine so they can discover high blood pressure earlier rather than waiting 3 or 4 months to see the doctor and the doctor tell them that the blood pressure was high. But if it was high for all those 3 or 4 months, there was damage, continuous damage to all the organs. In addition, you can detect the so-called white coat hypertension, where the blood pressure is high when you see the doctor, but at home it's normal. Maybe if that's the case, your doctor might not need to increase your medications. Avoiding salty food is very important for blood pressure control. If you smoke, you need to stop smoking. It's not easy. There are many smoking cessation programs. You find difficulties try to get hold of one of them, but it injures not only your lungs, your heart, your kidneys, predispose you about cancer, also injures your blood vessels, and all those diseases are diseases of blood vessels. I hope you can find a way to stop smoking. Your health and the people around you that also smoke that smoke then no smoke sorry that breathe that smoke will thank you. If you are taking medications, you try to take them properly as your doctor tells you, because your sugar control will be better, and if it's a better sugar control, you will avoid complications. Most doctors target the HbA1c. Check with your doctor what is the correct level for you. I also try to target HbA1c, but also I use the ambulatory glucose monitoring and profile to guide management of my patients. You need to monitor your blood sugar. The method maybe doesn't matter too much if it's pinpricks of the ambulatory glucose monitoring, but it depends on how severe your disease is. If your diabetes is very stable on diet and other medications, probably you don't need to go to the ambulatory glucose profile once in a while, check your by finger pricks. But if your diabetes is unstable, you constantly go to the hospital because of complications or hypoglycemia, or you are taking large doses of insulin, you probably will benefit from the ambulatory glucose monitoring and getting an ambulatory glucose profile. Get your eyes checked by an ophthalmologist, an eye doctor, because as I mentioned before, diabetes in the beginning can be silent. It can be damaging your eyes and you don't know. And when you start developing problems, sometimes it could be too late because diabetes can cause blindness. So try to see your doctor. Also, get your feet checked by a podiatrist at least once a year, or more often if you already have diabetic foot. But if you don't have, Just check always, every day, your food, because if you have diabetic neuropathy, sometimes you have problems in the sensation. If you walk barefoot, you might get a splinter, you don't feel it, but it can get infected, and this infection can spread to the bones or even further, and people can even lose the limbs. So just check your feet every day, look for splinters, look for erosions, for signs of inflammation, redness, and consult your doctor if you find any of them. Try to walk with comfortable shoes. Don't walk barefoot at home or elsewhere. The same goes for the teeth. Check them with your dentist because teeth and gum disease is very frequent in diabetic patients. If you have elevated uric acid, follow a diet or take the anti-uric acid medications. You might have some blood pressure medications or that have antiproteinuria effect, especially if you have diabetic kidney disease. So take them as your doctor prescribes because they try to protect your kidney. If diet is not sufficient for you for lipid control, you take your anticholesterol medications as your doctor prescribes. Take aspirin if your doctor thinks it's necessary, if you have cardiovascular risk or if you have already heart disease. But check with your doctor because aspirin can have some side effects as well. Take your vitamins, or either by eating a balanced diet or with tablets. Check with your doctor. Check also with your doctor what vaccines are important for you. Typically, pneumococcus and influenza are important in diabetic patients, but there might be other vaccines also. Drink alcohol with moderation if you do it. If you don't do it, so good for you. If you get pregnant, inform your doctor on time because you might be taking medications that are not suitable for pregnancy. And also, diabetic control has to be watched, more closely if you get pregnant. Do not miss appointments because you are missing the chance of discovering something or the doctor gives you good advice for better control of your disease. Communicate with your doctor. Ask all your queries and concerns. If you have side effects, inform your doctor. If you're not responding to medication, also inform your doctor. He needs to know that so he can change all the medications, all the management if it's necessary. So, this is the end of the video series. Thank you for your attention. This video series was created for you to try to, give you some elements that you have better knowledge of your disease, so you can control it better, have better communication with your doctor, so to control better your disease. So this video series is for you or for people around you that can benefit from having this knowledge. So please share it because other people might benefit from it. Please stay tuned. In the next videos, we will talk more about Janus and Aries, these weight loss management programs. Also, I might add some extra videos as a bonus on diabetes later on, but as it was designed, this is the last video of the series. Thank you very much for your attention. Dr. Francisco, wishing you the best possible health. Take care. Bye-bye.